I'm Dr. Patel. I'm practicing family practice in Dallas, Texas. I've been practicing for the last 25 years. Uh, Back in 2006, in one of the ACAM meeting, I got involved with Poly MVA, and having discussed with Gary, and he really convinced me on using Poly MVA. I bought about 12 bottles there, and I went home and I started thinking, I say, that what I need, but I'm an oncologist, but still I went ahead and uh, went home. Next day I talked to my girls in the practice, and they all got excited, and then one of the employees came up to me and says, does this help in cancer of the pancreas? I said, yes, certainly any cancer. Next day she comes with her cash money and she wanted to get a bottle. So I went ahead and gave her the bottle and told her to take 2 teaspoonfuls 4 times a day. It's going to make her feel bad first couple of days, make him feel well, and then after that we'll be okay. Anyway, 2 weeks later she came and bought a second bottle. Another 2 weeks later, third bottle. So obviously she was working. So I asked her how he's doing. I said, oh, doctor, he's doing so good. He's been playing with the dogs, and he's got all the energy. He's driving and running errands. So I said, well, that's good. I said, well, I need to see him then, bring him in here. So I got him in my office and then ran his blood test, and then also told him that he need to take some other stuff along with Poly MVA to help him his immune system, like omega-3 fatty acids, N-acetylcysteine, CoQ10, L-carnitine. And so he agreed to all that, and so we went ahead and started on those supplements. He continued taking 2 teaspoons 4 times a day, and this was a person who had cancer of the pancreas, he was diagnosed in 2005 November. Went to a surgeon opened it up, and then couldn't take a tumor out, so closed it up and then sent him home for just to take care of his business. Well, then he went ahead and called Baylor Hospital, and went to Baylor Hospital and went and had 2 chemos and 2 radiation. That zapped him, and they sent him home for rehab and told him to take care of business. Well, this has happened about 6 months later. Obviously, he comes out of rehab and goes home, and that's when he gets my Poly MVA. And so he started taking that, and 6 months later, he comes to me again and says, doctor, I want to do the scan. So I went ahead and ordered the same scan, which he had previous to the Baylor. And this scan obviously showed, the first scan showed was 9 centimeter tumor. The second scan, which I did, showed 3 centimeter tumor. So his Poly MVA was working, that's all. He wasn't doing anything. He had surgery, he had chemo, his radiation. They all wrote him off, and then we started Poly MVA, which suddenly he's been taking 2 teaspoons 4 times a day, and he's still taking it. It's now almost 2 years down since he was diagnosed with cancer of the pancreas. And now I told him to continue taking 2 teaspoons 4 times a day, and he's fine. I've also had a couple of other patients who had started taking the Poly MVA. One has a cancer of the breast, and she did pretty well through her chemo along with Poly. And lately I started another patient with a lung cancer who had a recurrent lung cancer. She initially had cancer of the lung, which was operated, taken the lobe out, and now she's got a mass in the right lung, which was pretty big, and so she started taking chemo, and she happened to be the relations of the person who I treated with cancer of the pancreas. So obviously she believes in Poly MVA, so she took it, and she's been taking it, and it's almost about 3 weeks she had the chemo and all that, and now after the chemo was over, they said that she'll not need any more chemo because her mass has regressed, and she continues taking the Poly MVA.